Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Since 2021, countries have been drafting a pandemic treaty aimed at ensuring there's a better global response to the next pandemic. Dr. Alexandra Phelan, an expert in global health law, joins the podcast to talk about some particulars of the treaty, why the stakes are so high to draft and agree on a treaty like this in the first place, and why a major deadline to sign it was missed. Let's listen. Alexandra Phelan, thank you so much for being on Public Health on Call. Today, we're going to talk about the pandemic treaty. So could you give us a little bit of background on the pandemic treaty?
Thanks so much for having me. So at the height of the COVID-19 pandemic back in 2021, countries recognised that the international system had really failed to respond to the crisis. That included, what the WHO, the World Health Organization, had been tasked with doing. That included countries' own reactions. And really the big issue was vaccine inequity and what we saw with the distribution of vaccines over the course of the pandemic. And so, guided by the principles of equity and solidarity, countries started a negotiation process through the World Health Organization to negotiate a new international treaty that aims to address pandemic prevention, preparedness and response, and the gaps in international law for those areas.
Can you give us an idea of what some of the proposals were?
Yeah, so some drafts of the negotiating text have been released over time, and so we've seen that refined. And they include issues, in the latest version, they include issues like upstream prevention, so looking at the drivers of pandemics like land use change and climate change, taking a One Health approach, which means looking at the animal, human and environmental intersections for human health. Preparedness of health systems, ensuring a strong healthcare workforce, and then getting into the details of things like transfer of technology, the equitable distribution of vaccines and access to pathogens, and how we might strengthen our global logistics and supply chain networks. So it's an incredibly broad set of areas that have been captured under the draft so far.
And can you tell us what the journey of this draft has been?
Yeah, so it's actually only quite recently that countries have gotten into what we'd consider substantive negotiations of the treaty. There was initially a broad sort of conceptual draft that tried to cover the field of all the different issues that countries might want to explore. And that was, refined over time into just an outline. So we sort of went from very broad to sort of a much more high-level document. And then as countries actually started with a proposed draft about 6 months ago and started negotiating the text, they went a number of months at this very high level, very detailed level of treaty. And most recently, to about 2 months ago, realised that they were going to run out of time and scaled it right back to a skinny treaty, is one phrase, or a framework-style treaty that tried to address things at a much higher level and give space for issues to be detailed at a later date. And that's kind of what we're looking at now with the most recent draft.
And what was the deadline that they were up against?
So they were aiming for the World Health Assembly 2 years after they started negotiations. So that was just held in May and early June of this year.
And who was at the table during, this time when they realized they were going to run out of time and they just needed to get something through? And I want to be clear, first of all, it didn't pass, right? It didn't go through. What is the status of it right now?
Yeah, great question. At the World Health Assembly, right down to the last minute, countries were trying to see if they could come to an agreement and be able to adopt this treaty at the World Health Assembly. And they realised they didn't, but they did decide that they wouldn't end the negotiation process. Instead, they would extend it for up to another year to the next World Health Assembly in May 2025. Or if they can come to agreement earlier, they'll convene a special session of the World Health Assembly, which would be looking at more sort of later this year.
And I want to go back to my question about who was at the table, because that was a really important part, I think, in what I've been reading about why this didn't quite go through very smoothly.
Absolutely. So the parties negotiating the treaty, countries are member states of the World Health Organization. But there's civil society that have been engaged in advising countries or providing advocacy on certain issues, as well as industry has been in the sort of broader room of providing their position. So pharmaceutical companies, and there's a lot of behind the scenes negotiations going on. But in the negotiation room itself, we also see blocks between member states. So we have a large group of equity that represents countries largely in the global south and their push for equity under the treaty, and then sort of other different groups. So the European Union countries typically will block together as part of the EU. We've seen the African region countries block together as the AU, and it's allowed countries to sort of put positions forward in a sort of in a unionised manner. And that's really been where the dynamics have played out, with high-income countries pushing for certain issues, particularly on technology transfer, on access to pathogens. A wide set of countries, but really driven by the group of equity, pushing for equity and solidarity and equitable access to vaccines, diagnostics and therapeutics.
So let's talk about some of these specifics. When you say transfer of technology, what does that mean?
When you want to make a vaccine or a diagnostic or a new drug, there's a lot of technology in that. There's soft technology, which is sort of the know-how of how to actually make the product, and then there's the hard technology that might be the actual the factories and the equipment that's required. Some of that will be covered by intellectual property, which means that the process of how to make a vaccine requires that transfer of technology from the people that hold the intellectual property or the know-how to groups that are going to be producing that technology. And so the idea here is that technology is, particularly for pharmaceuticals, are concentrated in the global north. Not completely, there's a range of different manufacturers around the world, but the idea is that know-how, that potentially even that hard technology, is made available to the global south, but also to countries at different income levels as well. So it's not necessarily just a global north, global south transfer, although that is primarily what the treaty is really focused in on.
So you have a group of countries that are higher income that tend to, for lack of a better term, maybe hoard some of this know-how and some of this technology. And then you have a group of countries that are saying, no, if this whole thing is going to work, there has to be equitable access to these kinds of things. Is there middle ground here?
Yeah, we've seen in the more recent versions of the draft a lot of language around facilitating technology transfer rather than compulsorily requiring technology transfer, or having voluntary or mutually agreed terms. And so you start to see the legalese creep into the treaty text. And a lot of this contention has come down to the nature of these obligations, like how binding they are, whether they are compulsory or voluntary, and the relationship between countries and their industry, and to what extent can the treaty dictate that, or can countries enter into a treaty that would dictate that dynamic? I think one thing to really reflect on here is the large reason why high-income countries have the resources, the financial and technical resources, and the imbalance that exists is because of long histories of colonialism, of slavery, that these are entrenched inequities. And I think it's really easy to just look at the snapshot of now and say, oh, this is an unfair dynamic that we can address through transfer of technology in a voluntary way, rather than saying, well, hang on, there's been extraction and extractivism of resources that has facilitated the creation of industries that has led to this inequity. And so that's where we really start to see this idea of pathogen access and benefits sharing, which is a big issue in the treaty. push from high-income countries to get access to pathogens that they need to create vaccines, diagnostics, and therapeutics, and the push on the global south to provide that, without necessarily saying, well, we're going to equitably share the benefits that arise from the use. And that's a real historical dynamic that we see play out in lots of resources, and we're seeing it play out in the pathogen resources here, and why that has become such a core issue in the treaty.
And when you say pathogen resources and that the global south has them, what does that mean?
Well, it's a really great clarification question, because I think as we look at H5N1 here in the United States and intensive livestock production, we know that pandemic threats emerge in a range of different scenarios. The dynamic at play here is based on a history where a number of global south countries have been subjected to sort of a scientific extractivism, where high-income countries, researchers have come in, have isolated pathogens, taken them out of the country, then used them to produce these vaccines, diagnostics, and therapeutics. But as you point out, what global public health preparedness is reliant upon is sharing from all different ranges of sources. We've seen the sort of data delays with H5N1 sharing and pathogen sample delays with H5N1. And so really, it's not as simple as that dynamic, but where we see the power imbalance and the injustice is within those dynamics.
I'm glad you bring up H5N1 because it's a good reminder that, I think a lot of the time when we say the word pandemic, people automatically think of COVID, which makes sense. It's very recent. It's fresh in our memory. However, it is not the only pandemic, and it will not be the only pandemic. And the fact that we already have this emergence and this strange viral spillover that's happening right now, there's a lot of urgency here. This is not like we have another 100 years before we have to worry about this again. The fact that we didn't hit this deadline is very concerning.
Absolutely. We know that climate change, biodiversity loss, and chemical pollution are all rapidly accelerating and driving the emergence of potential new pandemic threats, the interactions between animals and humans, and that interface of potential zoonotic spillover. And that's increasing at a rapid rate. And so time is of the essence in getting some of these governance structures in place now, so that we are prepared for the next pandemic, and that we can perhaps even be taking steps to prevent the next pandemic. Now, we have a little bit of international law for pandemic influenza specifically, because it is such a high threat of pandemic. But what we saw over the course of COVID-19 is that a lot of those norms, those expectations under what we have for influenza were undone in the COVID-19 context. And so with the pandemic treaty, even if we end up with a very high level agreement at the end of the day, part of it is about rebuilding that trust between countries. It's about rebuilding those norms, those expected standards of behaviour between countries and the institutions like the WHO. And so I think that's kind of the urgency as well, is we need to be starting that process of rebuilding that trust.
You mentioned, all of this, hundreds of years of colonialism, of some pretty bad history, inequity, and then, the last pandemic, we saw how that played out. It seems like a pretty tall order to think that this treaty could move things forward. What do you see a path forward with all of this negotiation, something that could actually reshape how we work together when it comes to global health?
So there's been a lot of, discussion about multilateralism generally and the power of international law to address the challenges that we're facing on a range of different issues. And what we've seen in some ways is this shift to more of a multipolar environment. That is, that rather than just having, say, the US or even China as sort of the power players in the room, we're getting more power players in the room like Brazil or India, different dynamics, the African Union. And I think that's where that union approach has been so critical. It's helped establish those power blocks. It's shaped the narrative during negotiations to one where equity and solidarity are continuously brought back to the table. And I think that because of the scale of the injustice seen during COVID-19, it kind of reframed the discussion and re-empowered those who had suffered during the crisis from inequities and injustices between countries. And so I think that shift to multipolarism is a good thing for multilateralism, that is the use of international law between countries to solve these problems. But there's still a long way to go. There is still a lot of colonialism embedded in international law itself. The system itself is one that was not necessarily built for equity and solidarity. So if we're wanting to make a better world and we're wanting to imagine what that could look like, the pandemic treaty perhaps gets us somewhere towards that imagining. But it's only going to be one step in a much broader process that is well beyond just the scope of pandemics.
But how is this enforced?
Really good question. And that's, I think, the first question that students studying international law often ask is international law? We don't have a global police force. We don't have necessarily a global court like we would imagine a domestic court, a court within a country to look like. We do have an international court, the International Court of Justice, and if disputes arise, it is available for countries if they consent to take their disputes and resolve them at that level. And we're seeing advisory opinions on climate change that are likely to be relevant for health, a whole range of different issues relevant to health before the ICJ. But when we think about enforcement, that's where we come back to this question of norms that I mentioned before, these standards of conduct. Peer pressure, even at the international level, is incredibly powerful. And I think we can't discount the idea of what it means to be a good global actor and why states want to be good global actors. That being said, there have been really clear pushes for greater compliance mechanisms that would hold states to account against their obligations and have that review process. And I think they're really salient, really important calls that it is vital that we monitor countries' progress as they implement their obligations and we find ways to facilitate that compliance, even if we don't necessarily want to use a punitive mechanism in the space of public health.
Holding each other accountable is obviously a huge part of this, and you mentioned that there is, it sounds like there's a lot of political will to actually have these conversations. What can we expect to see next?
So now that countries have decided they want to continue to try and negotiate this treaty, and I think that absolutely reflects what you say, that there is this high-level political commitment. We will have the next meeting of negotiators, likely in mid-July. The timetable hasn't been released yet. And then what the procedures are going to look like is still a little bit up in the air. There is the potential that the negotiations will be made a little bit more proactive, and so there'll be parallel negotiations happening at once to try and move the treaty along. So the modalities, the procedures are still a little bit to be decided over the coming year. But, we'll have this meeting in July. We'll get some clarity over what the next sort of 6 months looks like. And potentially, if progress can be made and countries have the resources and the availability to commit to negotiating on a pretty tight schedule, we could see a special session of the World Health Assembly being called, later this year, potentially early next year, in advance of the May 2025, which is the sort of next ultimate deadline if they don't come to agreement beforehand.
Well, this is an incredibly important document, and this is a very important time for global public health, and we really appreciate your insights on it. Thank you so much.
Thanks so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.